At Carafem, you can choose the abortion care that works best for you. With in-person visits in Atlanta, Chicago, and the D.C. area, or medically supported abortion pills by mail in 20 states, some people feel more comfortable meeting with a provider in person and leaving either no longer pregnant or with pills in hand. Others prefer getting abortion pills by mail. Just fill out a short online form, and if eligible, your medication arrives in a few days in a plain package. When you choose abortion pills, Cara, our text-based abortion companion, is with you every step of the way, offering 24/7 support and answers whenever you need them. However you get care, Carafem will support you every step of the way. Learn more at carafem.org. It's okay to want an abortion. Did you know 1 in 4 people who can get pregnant will have one? So it's actually more common than most people think. At Carafem, you can choose what type of abortion care works best for you. We have in-person locations with private entrances in Atlanta, Chicago, and the Washington, D.C. areas. And we also offer medically supported abortion pills by mail in 20 states. For some people, it's more comforting to come into a private office where they can sit with one of our medical providers and either leave no longer pregnant or with abortion pills in hand. For others, they prefer to get abortion pills through the mail so they can decide the best time and place to complete the process. Getting abortion pills by mail from Carafem is simple. Fill out an online form, and a licensed provider will review your medical history. And if eligible, your medication will be shipped to you in a couple of days. Cara, our text-based abortion companion, will guide you through the process from start to finish with instructions, reminders, and answers to all your questions whenever they come up 24/7. With either choice, please know Carafem will support you every step of the way. Learn more at carafem.org.
Welcome to My Breastie Says, two friends exploring life during and after breast cancer from two totally different perspectives. I'm Chris, a breast cancer survivor and a mother of two.
I'm Jenny, a physical therapist and medical professional who specializes in breast cancer care. Together, we created this podcast to bring both sides of the story, the medical insight and the lived experience. Hey, we have a really exciting episode today. With us is Michal Cohen. She is a makeup artist for over 15 years and also doing permanent makeup, which she will talk to us about. She's been doing that for about 7 years. Her studio has the best name. It's called Beverly Hills Inc., INK. So she's obviously located in Beverly Hills and just named Hollywood's secret beauty resource by The Hollywood Reporter. So Michal, welcome.
Thank you. Thanks for having me. It's super exciting.
I'm so excited personally about this because I've had so much. I've done permanent makeup, and it's really hard to find your person, and especially going through chemo and all those things. I mean, I lost this. I'm pointing to my right eyebrow, but and you can see I have to fill. I still have yet to find a makeup artist. That's why I'm excited to meet you and have you on to do eyebrows. Because I've only done the lip blushing because I had a scar on my lip to cover that.
Oh, cool.
But the eyebrows is an art, as you know.
Yeah.
Yes, it's a little daunting to go, especially when you go through chemo and stuff. So
totally. And I feel like, I don't know, my aesthetic, I will always say this probably, and a lot of the questions you'll ask me is less is more. And so I always try to err on the conservative side with permanent makeup because I'm sure you've seen women walking around the city with crazy makeup. Crazy. Yeah. They're blocky and saturated.
And they, for me, it's Jenny, have you seen this? When they're really close together and they just look
Yeah. And again, I mean, hey, different strokes for different folks.
Yeah.
But I think all of us on today are into the more natural look.
Got
you interested in going from makeup to permanent makeup?
Well, honestly, initially it was a way to bring in a more steady source of income because I had my daughter and I was like, I need to just know what my money is. And when you're a freelance makeup artist, you're like, when's my next job? I'm not quite sure. So a friend recommended I look into microblading. And so that's where I started. And then from microblading, I went into scalp micropigmentation. and lash enhancement and then lip blushing. And then recently I started areolas and scar camouflaging because they kind of go hand in hand. And so it just sort of grew. And then I also just loved, because again, as I mentioned, I'd be walking around and seeing these women with the crazy eyebrows or lips and I was like, oh my God, like, does it have to be that crazy? I'm sure I could kind of have my own signature on permanent makeup. So that was my intention too, was to bring a bit more of a natural look to permanent
Which
makeup.
is so great, because as we already mentioned, like the three of us, that's more our look. But where would someone, and again, to Chris's earlier point, like looking to find someone to do her brows, if the only option is really saturated, that's
I went on a deep dive and on your Instagram,
oh boy,
which is what is it again? Because I want everyone listening to go and check it out, because I was really impressed.
Yeah, it's Michal makeup. So a lot of people get my spelling of my name incorrect. So it's like Michael, but no E, and then makeup. And I do, you'll see, I do like a ton of, I still do makeup. So you'll see bridal makeup in there. You'll see brows, you'll see lips, you'll see areolas. Like it's just a nice, I was always thinking, I was worried if you did the deep dive, I'm like, oh my God, were you confused? Because I feel like people would get confused.
I'm really laser focused on, I have never done my eyebrows, and your work with the brows looks so good. Because normally someone recommends a tattoo artist for the brows, and I look and I'm like, oh, I don't like the shape. I don't like it, just doesn't look natural. And yours really did so much. You know that I called and tried to make an appointment.
Oh,
I
you
will,
did?
yeah.
Oh,
I left a message, but now I got you. So
you did? I didn't get a message. This happened. You're like the second person. So now I'm concerned.
well, that's good. You're making people chase you. That's good. That's a good thing.
No, but I'm concerned now. I'm not getting the message. Where's the voicemail?
Well, I'm coming in because, like I said, when you go through chemo, not only you lose your hair, if you're not, I did the cold caps, I lost like 30% of my hair. But the thing that no one really talks about is the eyebrows, the eyelashes. My dog's making all sorts of noise, sorry. But and my eyebrows never grew back the same.
Talk about that, Michal. What do you do? Eyebrow blading and what actually is that, or is it tattoo like we think of how you tattoo other? Could you explain a little bit more what the process is and who's a good
Sure. So, okay, so I started initially with microblading, and that's a manual. It's first of all, it's all tattooing. No matter how it's marketed, it's tattooing. And it's always been very frustrating to me because people will be like, oh, it's semi-permanent. When you're opening skin and you're depositing pigment, it's a tattoo. It just we might not be using, tattooing inks, but we have a special cosmetic pigment that we would implant so that it could fade over time. But there is a big difference there. So anyways, with microblading, that's more of a manual implantation. I've graduated to nano brows, and what nano brows is you're utilizing a machine to implant the pigment. And that is created with pixels versus with microblading, you're kind of cutting into the skin, which I felt was more limited to certain types of skin, whereas nano, you can work with pretty much all types of skin.
I did the microblading years ago, and it was a friend who was training. So my eyebrows are not great. Yeah, but to your point earlier, I really thought,
wow, you're brave, Jenni.
Temporary. Yeah, I was foolish is more what it was. But I thought it would be temporary. I'm not sure it is temporary, but it didn't feel great. Like you could really feel the almost like, I hate to use the word slicing, but it felt like little slices. Can you explain more what the micro pigmentation is like, if I said that right?
Sure. Well, yeah. So it's nano brows, micropigmentation. Some people call it nano blading. Basically, it can feel similar to microblading. It just depends on people's sensitivity. I mean, this is the eyebrow, the skin around the eyebrow is a bit thinner, so I have to take that into account. But like you said, microblading, we're making slices into the skin, kind of like you would like cutting a steak. And with nano brows, it's pixels. So it's like the needle is moving thousands of times in a second into the skin and making tiny little dots. So I find clients tend to be more comfortable with the nano brows and versus the microblading. And also with microblading, you numb beforehand, and that sometimes that actually can be not so great for the skin because it's filling up with water. So
interesting.
So while like it is numbing, it's kind of like if you've ever had microneedling, it's, anytime you're putting numbing on, the skin is filling up with water. So it's not always like a guarantee that it's going to be completely painless.
What about for the lips? Do you, because they do numb the lips right? Or do
you can kind of, I do a little bit of both. I do like, I actually start to tattoo without numbing and then do a quick swipe of numbing because you start with the outline first.
Yeah.
So, and then quickly do a swipe of numbing and then take it off and then kind of gently work over the lips. And then again, do a quick swipe of numbing and take it off. Because again, when the skin fills up with water, it also creates a little bit of a discoloration. So it's hard to see, especially with lips, because lips are so vascular. It's hard to see like what the color's looking like. So I've learned a technique to just sort of like apply the numbing and then remove the numbing because you don't want it too much numbing. You kind of want to see where the lips are headed.
So interesting. How long does it last on the lips versus the eyebrows versus the areolas? Like, how is there like, I know it lasts to a certain degree, but how long before a touch up, you think?
Lips tend to last pretty long. Once you have a touch up, it'll be like about 2 years. Brows, there's more oil around the brow skin, so it fades a bit faster. But you can usually expect that about a year at least.
It's interesting because I had my lips blush because I don't want to do filler or anything like that, especially like in the lips. And what she did was she put like the corners, like refilled the corners of my lips, which made them look so much fuller, especially like you not approaching in middle age. But I just think that like the lip blushing, it's not as severe as what people think it's going to be, the color, right? It's just like that natural, it depends right?
It depends on the color you pick. I mean, like I said, I like to be conservative. I like to go natural. And I also take into account the age and the wants and needs of my client. So I have had a stage 4 cancer patient, for example, and I was like, oh, I don't know if I want to use there's carbon-based pigments and those last a little bit longer in the brows. And I was like, I don't know if I want to do that for her. And my friend, a good friend of mine, this was her aunt. She was like, just do whatever she wants, whatever's going to keep the longest, because we just don't know where she's headed. So, that's fine. But like, let's say I have a 25-year-old client, and you can kind of tell when you're in your 20s, you're sort of trying things out. And these girls want to get on a trend sometimes. And I'm like, let me just throw in like 3 lines in your brows. You just really need it here, here, and here. You don't need like a whole look.
That I love, because I've gone through consultations for my eyebrows, and now I just have like, because of the chemo and losing all the hair, like bare spots. And they want to do a whole eyebrow. And I'm like, oh, no, no, no. I will look crazy. I just want filled in a little here, a little here. So I love that you offer that.
That's been I'm sorry.
Oh, no, go ahead.
I was going to say that's been in the past couple of years. So when I first started microblading, I was doing the same thing, doing like a whole eyebrow. And then you learn obviously from your craft. And I learned that the brows can get saturated. And once they're saturated, that's why I say like less is more. Let's start with a little bit. Let's start with a diluted pigment. Let's start with a lighter pigment. We can always add more. Because we can add. And so I've also noticed too, and I'm sure you've seen them walking around the city, that when people have their eyebrows fully filled in, they're really dark. So it's just best that like, if you just have like a whole, like I offer partials. So like for me, it was like, I just really hated the ends of my brows. So I'm like, just do the ends. Like don't fill in anywhere else. And that way I could get more of the look that I was after. So anyway, I started applying that to my clientele. Like, let's not do a whole thing. You don't really need it over in the front. You just really needed the arches and the tails, and go
I
from
love
there.
that.
I have to say, for our listeners who are listening to us via podcast, you might want to check out YouTube for this one, because Charles and Chris's eyebrows are phenomenal. Or sorry,
mine are filled in. That's why I'm coming to see you, Michal. Am I saying it right?
eyebrows will be phenomenal.
I'm going to mess up your name.
That's okay.
Yeah, I feel like I am too. Now for back to the eyebrows, I've had some patients who, before they lost their eyebrows, like they knew chemo was upcoming, they had some tattooing done in their eyebrows before they lost it. Have you worked with clients that way? Do you recommend that if possible?
I had a client that really wanted to come and see me prior to chemo. She was very nervous about losing her eyebrows. The problem is, we can do it. And I mean, because I'm willing to work with a client, and I just hate to see a woman suffer. I'm not going to, I hate to say no, because I'm like, oh, I don't know how it's going to be, but I do try to educate my client and say, okay, so like we can do that, but I can't guarantee that, if and when the brow hairs fall out, how much ends up falling out. Like, we don't know what's going to happen then once you recover, how much will come back. So it's totally fine to do but again, it's like, then I'll just kind of err on the conservative side, do a lighter color, and still do it. But I had a client that it was like I think almost a year ago, and then she didn't end up doing the brows at all. So
well, it's good that you offer a consult to really, get into their head and see what they want and what the goal is.
Yeah. And I do offer a free FaceTime consultation. So, if anybody just wants to ask some questions, you can always just hop on my website and book one.
People who do insist on doing brows before they fall out, before chemo, is the risk then that you might have to go back in and do more touch-ups? Like, you can't really predict what will happen. Is that what the concern is?
Well, one thing to note about just tattoos in general, if you're ever doing an MRI, the MRI can knock out the tattooing pigment. So whether it's
wow,
that's interesting.
I never knew that. That's such an interesting fact.
Yeah. So, keep that in mind. But I would say if a client really wants it beforehand, like, I would give to them. I mean, why not? If it's anything that helps you feel like within your body, because cancer takes you so much out of your body, or makes you feel like your body doesn't belong to you anymore, or at the time, then if that makes them feel great and helps their self-confidence, then I'm happy to do it. I just, it's not necessarily that there will be complications, but I can't guarantee that it might fade a little faster because of the chemo or radiation.
That's fair. And then now I did a little Googling, and as far as women undergoing cancer treatment who want to do tattoos, that we need to have good, healthy blood counts. So white blood cells need to be in the good range. And if you want to work over a scar or radiation, wait probably at least a year, but talk to your doctor. Do you have any other guidelines that I may have missed that you talk to your patients about?
Oh, for if they are have any concerns prior to coming in?
Correct. Like, who would you not tattoo because medically they're not healthy enough right now with treatment?
Well, especially if anybody has any diabetes, that is one thing for sure that you have to get confirmation from your doctor. If you're coming in post-treatment, we want to make sure your skin is fully healed. There's no open wounds, nothing like that. Sorry, I think the postman is dropping some mail.
Okay. My dog's here, and she's making all sorts of noises too. So
yeah,
with scars, because scars continue to change over time, right? Like the scabs fall off, and you have a nice pink scar, and then over time that'll fade. Is there a certain point in the scar, like after that, do you want the scar to stop changing colors before it's a good time to tattoo?
Yeah, for scars, we generally want to wait 6 to 12 months, depending. Like
wow, okay.
It depends on if it's still pink. I mean, then you want to wait 6 months at least.
Okay.
And then we can see I mean, because you don't, if it's, especially if the scar is purple or like keloids, you can't really do much with keloids, unfortunately. But purple scars, those are tricky because I actually send clients first to laser to try to work with that first.
And what do you want to, what does the laser do?
The laser can actually reduce that discoloration.
What kind of laser?
Well, that is a good question. I don't know exactly which laser. I can find out. But I have some magical laser folks in my community. I was just yesterday at my physical therapist. I had broken my foot, not this past summer, but the previous, and I needed surgery on my foot. And I had a nasty scar because it like opened from the bacterial wound or bacterial infection. I know, it was awful. And by my physical therapist, he is Taiwanese and he gets these amazing lasers from Asia. And he's like, look at the scar on your foot. It's completely gone. Like it's it's minimal. So, I mean, it's just amazing all what people can do now. Before, I would always say to do that before doing anything invasive, like even scar camouflaging, because also with scar camouflaging, that's a whole different thing. You want to make sure you're going to the right practitioner because over time, scar camouflaging can also turn white if you're not careful. So
it's interesting because now, I don't know if it's my age, but now I had 2 biopsies recently, one on my leg, one on the inside of my chest, and like with the cleavage area. And the way they did the biopsy, I keloided, which I've never keloided before. So now I do need you're giving me all awesome insight and information about maybe we should put it in the copy here about, whatever lasers that you're talking about.
Also, I did want to touch on, there are so many lasers out there. And so it can be frustrating as a consumer to know which is the right one. So
absolutely.
If you're listening to us today and you hear us talking about laser and you're like, oh, my friend has a red mask laser, like that's not, no, even in physical therapy, we have different lasers, but I don't know if ours are the scar type. So really do your research with someone who knows lasers. They're not all created equally.
Yeah. It is pretty new technology. So you want to go to somebody who knows what they're talking about. I refer people also for laser tattoo removal because often I'll get people that want to come in and they're like, I'm so sick of these. What do I do? So you want to go to the right laser. I have somebody here in Southern California who's wonderful, who will not remove any brow hair because that's a big thing now. Where I've seen it on Instagram and where they're like, don't do this because your brow hair is going to fall out. I was like, that's not true.
Yeah, I love that you said go do these things and research before doing the camouflage tattooing, because a lot of times, myself included, I'm like, I'm going to get it, I'm going to get the keloid camouflage with the tattoo or whatever. But, I think doing your research, what's the thing like measure twice, cut once type of thing?
Yeah.
It's important.
Yeah. I from my experience, I've just find like, let's first try to manage the scar and get it corrected. There's also inkless tattooing, which is, it's kind of like microneedling where you're going to go over the scar first. You're going to break it up, do a sort of like, little like pin pricks.
Yeah, like how is that kind of microneedling?
It's just, you're using a different kind of machine.
Okay.
So I'm using a tattooing machine versus a microneedling machine, but it's sort of the same. You're breaking up the skin, kind of trying to generate more collagen so that it repairs. So I think at least with a tattooing needle versus a microneedle, you can go a lot deeper. So you do have to be careful with who you're going to. But anyway, so that's been also a newer sort of technique, is to go over the scar, break up the skin so that it will regenerate and become flatter.
But it's so interesting because scars change so much over time, and so does your body. So when I had my double mastectomy, and they like opened you up, took out all the tissue, and the scars were like underneath. I'm like showing on
Almost like an
YouTube.
underwire kind of.
Underneath here, yeah, on YouTube, you can see that. But
Yeah.
they're gone. I have no scarring. It's
Wow.
so crazy, like that healed over time. And had I jumped the gun and ran and did all the things, whatever, not just like first they were like purple and then they were white and then, or red and then white. So
Mm.
yeah, you really just got to take your time with the scarring and then
Yeah.
all the stuff.
Yeah, you have to be patient in general, especially
Mhm.
I say this also with tattooing. You've got to be patient with whatever your goal might be because sometimes it takes a minute to achieve it. You're not going to necessarily get it overnight. And
What
even if you do get it overnight, sometimes then like over time it doesn't heal properly. So
I know. Or what about
yeah.
the colors that you see people walking on the street where the eyebrows or something, it fades to a really ashy color. Have you seen that, Jenny?
Yeah,
Like,
I've seen that.
and that to me
Mine
is
is doing right now.
no,
Mine.
no. But how do you not do that with people? Like, what's the
Well, we always say there's never a guarantee because we don't know what your body is going to do with this pigment. We also don't know what you're doing at home, what you're ingesting into your body. That can
that's
also
true.
change pigment. Um, Oily skin can also blur pigment if you have rosacea. So
Mhm.
there's all these different factors. But I have clients that are like, I don't care. I still want to do it. And I understand the risk factors. So there's there's not necessarily a guarantee, just like when you had, like you said, you had the mastectomy and the scarring, like I'm sure they were like, it might heal great. It might, it might have an issue, but you're like, you're still going to do it anyway, right? Because,
Yeah, of
you
course.
know,
Mhm.
you have to protect yourself. So, I just try to really pay attention to the skin, look at the client's undertones, and try to select a pigment that I think would be most complementary for them. I tend to also work with warmer pigments
That's what I was going to
versus,
ask you. Mhm.
yeah, versus cooler pigments because cool pigments already, that means that there's a lot of like blue in or like black. It's actually, excuse me, all pigments are uh, made of four colors: black, yellow, red, and white. And so cooler pigments will have more black in them. And so that's why you want to either dilute them or you don't want to use as much and you want to mix them more with warm pigments. So you just have to, I always just err on the warmer side. And sometimes a client might be like, oh, like that looks really warm. I'm like, trust me, your body will absorb that warmth and then it'll heal to be much more neutral than you think. But but over time and also sun exposure can also change
Oh,
Oh,
color.
yep. I wanted to bring up, so we met because we both have a dear friend who
Yes.
had her life changed by your work, but something she had done, which I didn't know was a thing. So our friend had breast cancer. She lost her hair during chemo, and then it didn't come back the way it was expected. It turns out she may have an alopecia issue that was exacerbated because the chemo brought on sooner. We're not sure. But you have done scalp pigmentation
Mm-hmm.
to help fill that in. Can you talk about that? Because even
what?
though this, our friend had maybe, I don't want to say an extreme version, but I know, anyone whose hair comes back thinner or different,
Mm-hmm.
this could still be applicable, I imagine.
Oh yeah. Scalp micropigmentation is a really great and easy procedure. I say easy. It's not necessarily pain wise for a client,
Okay, easy
but
for you.
it's easy for me. But also it's just like like that's one procedure that you get, I think, the most bang for your buck, and it's immediate.
Mhm.
Like so with scalp micropigmentation, we're just basically creating a shadow in your scalp.
Okay.
So I'm not going to necessarily bring back any hair. There's none. People are like, "Oh, do you do transplants?" I was like, "No, no, no.
No.
That is not this. This is literally like I am pigmenting your scalp, creating a shadow so that it looks more dense and full. However, if you were to go out in the sun or have a light hit you from the top of your head, you will still see there is a difference. I can't make that change, but I feel like, especially for women, because women, it's not common for women to have hair loss,
Oh, yeah.
So it's an easy way for them to feel like their hair is fuller without having like a topper or a wig of some kind.
So what is it? Is it like little dots creating a shadow like for the hairline
Correct.
or
So
like
I mean, you can literally do like your entire scalp if you wanted to. That takes a long time. It can be very painful because it's like, remember, it's like tiny little dots. So again, sort of like that feeling of microneedling, but in your scalp. So with our friend, we took a lot of breaks because it just can be a lot on a patient. But for women, I sometimes even just do sections. We'll just do like, like right here in the widow's peaks, because that's where women tend to thin even after pregnancy. Or if they also do thin, it tends to be from like the center of the scalp and out.
Yeah,
so
I just feel like my parts gotten wider over the years. Thanks, menopause, like all of those.
I feel like we all lose our hairline a little bit,
Sure.
right? As the older we get. So I never even heard it. Well,
Cool, right?
no, that's really cool. I love that.
Yeah. And I will also tell you too that I have found that by doing this, it has also, clients will say that it stimulates the scalp. So yeah, because it's bringing more blood circulation. Yeah. So sometimes they get a little bit more hair. So
that's great.
mhm.
That's a twofer.
Yeah.
Yeah.
Wow.
So is anything about areola touching? Because you've just started that, right?
Yeah.
Not just started, but that's one of your newest
Yes.
offerings. And how
Yes.
it's been for you? Like that must be really gratifying.
Yeah, I just actually worked with a top surgery client.
Oh,
Yeah,
incredible.
yeah, and it was amazing because I feel like especially top surgery clientele and post mastectomy cancer patients, it's very similar because it's both like out of body experiences.
If our listeners don't know the term top surgery, for our
Oh, for like a trans man. So it was a woman who wanted to get rid of her breasts. So it's
yeah.
yeah. And so then the nipples get, I guess, removed and then replaced. And so sometime
at top surgery's what? I'm so clueless, guys.
and so
I'm one of the listeners that doesn't know what the hell's going on. Sorry, go ahead. So
it's a woman who has chosen to transition into a man, and she wants to remove her breasts.
Gotcha. But men still have nipples.
Correct.
Yeah. Oh no. So they just realign the nipples.
Okay.
And I'm sorry. And it's not, this is also, this can be, it's a very, it's a complicated journey for some. And I know some women who actually have had top surgery that still go by she, her. It's whatever they want it to be.
So is this for the scar or the areolas?
The areolas, because when the areolas are repositioned, sometimes they can lose the pigment. And it's the same thing with like a breast reconstruction, not even cancer related. The breast can hypopigmentate. So I'll have scars like literally around the nipple.
Die, like one will be fine and then the other one got an infection and it died. Yeah.
Yeah. So so that was it's a very gratifying experience because for him it was just like he said, when if I'm shirtless, it's obvious, it's like a giveaway. And I don't want that to be the case, especially, I mean, for women, like, if you've been through a mastectomy, you're not necessarily walking around topless, or in public or at the beach or anything. But so it's a bit of a different story. But yeah, it's amazing. He was super happy, and I'm excited to have him come back so I can see how they healed and see if we need to do a touch up.
And do you do the 3D type, or I know sometimes patients, their plastic surgeon will leave almost like a little teeny nipple that then can be tattooed. I imagine you could do either.
Yeah, you can do a flat surface nipple. I mean, because it depends too. I think if they've had flap surgery, depends on the skin that's there. But yeah, you can do either a flat skin or one with a reconstructed nipple. You can do one that has or unilateral, where one side was done and the other side has remained.
Such an art. It is.
Such an art. And,
Yeah.
and also so life-changing too.
Yeah.
So
Yeah. Yeah. I'm excited to be able to continue to offer this service. This service actually was one that I had been waiting to do and talked about for like 4 years now, where I'm like, oh, that sounds like something so special. But I just was like, I need to get a little bit more experience first before I take that on. So, yeah.
I mean, I feel like it's making people feel whole again, and there is something that's connected to when a woman looks in the mirror naked or, just seeing her body, how she once remembered it if she doesn't
Mhm.
have the nipples, and the fact that you and people like you are able to just give her back that visual connection. I think,
Mhm.
for me, when I did the cold caps to not lose my hair, and being in the supermarket and having hair just made me not feel like a cancer patient. And I'm just bringing that up in relation to a woman being in the gym, in the locker room, and not
Mhm.
feeling like, not having the nipples might make them feel a certain way. Some women don't give a shit, and I love that too. And they're just like,
Mhm.
this is me, and I wear the scars are my, warrior award,
yeah. Yep.
and that is amazing as well. But for the other women who don't, might need the permanent makeup, I love that there's options for people.
Mhm.
So I think
The
it's
best feeling.
great that you're diving into that, and your work is so amazing. I'm a fan.
Oh, thank you.
This is
And
this is my consult, by the way, Michal.
uh,
This is my consult. I'm like, look at
perfect.
my God.
But I was listening to one of your episodes where you guys were talking about how some women take portraits, nude
Yeah.
portraits prior to their surgery. And I was like, hey, you know what? That's actually great for us practitioners, because then we have a reference. So of what,
Oh, that's wonderful.
yeah,
Exactly. Right. Yeah. So maybe if you weren't thinking of doing it, maybe just take a snap in case down the road you do decide you want to do some of this.
totally. And if you really want to feel like back to yourself, it's great to
Mhm.
have those.
Love that. Thank you so much for being with us today. And
Oh, no problem.
No, it's so great.
Nicole, could you please tell our listeners again where they can find you on socials, anything like that?
Okay, so I have a social, or you can find me on Instagram. Let me start that again. You can, you can
Okay, we
find.
mess up all the time on
I,
this show. We love it. That's what keeps us real, right, Jenny?
I, I talk. I just talk way too much, I feel.
Yeah.
Me
But
too.
you can. What was that?
Oh, I'm interrupting. I also
Oh.
talk too much. See? There it is in
Me,
action.
Yeah,
me three.
yeah,
Okay, go ahead. Sorry.
that's okay. So you can find me on Instagram at Michal Makeup. My studio name is Beverly Hills Inc. with a K, INK. And I have same matching websites, michalmakeup.com, which is more of my makeup portfolio site. And then Beverly Hills Inc. has more of my permanent makeup on there.
Wonderful.
Awesome. I'm excited. I'm coming in.
Yes, you'll see us
Yeah.
both soon.
Yeah.
So
We'll
much.
have you back again for the before and afters on my brows.
So
Yeah. Oh, that'd be great.
tune in to see Chris on YouTube.
Yeah.
Right. Yeah, you guys have to subscribe and support our new YouTube channel. So
Yeah.
so we can keep growing in that avenue and platform as well. But thank you so much for being here. This was great, and I love giving our listeners some insight and research that we've gone down rabbit holes, and what we
Mhm.
would suggest, or
Like we say, I mean, we're learning right along with you guys. So
Yeah.
thanks for
exactly,
educating.
exactly.
Oh,
And
and I was,
it's all
oh,
about being comfortable in your skin, whichever choice you choose, right?
totally. And I was going to mention too, with now that I'm starting areola tattoos, I'm offering complimentary areola tattoos. So,
No, you're not. Really?
mhm.
Oh my
Yeah,
God. Okay.
yes,
That
because
is,
I need to grow my portfolio. So if anybody out there is listening and is interested, you can feel free to reach out.
I
You're in the LA
love
area.
that.
That's great. Thank you. That's so beautiful.
Yeah, we have to put that in the copy, Jenny, because the people that can't afford it but really want it, I mean, it's expensive.
Can be, yeah.
It can be really pricey. But knowing you and what I've seen of your work, I mean, people better act fast before that portfolio grows.
I
know. So, okay,
Exactly.
well, so great to have you, and hopefully you'll come back for another episode.
Oh, absolutely.
We would love that.
I feel like we have so much more to talk about. We only
Oh.
talked about like a little snippet.
Right, so part 1. Part 2.
Exactly.
All right, we'll talk soon. Thank you so much for being here.
Oh, my pleasure.
Thank you for joining us today on My Breastie Says. Please don't forget to subscribe, like, and share this with a breastie who needs it. You can find us on Apple Podcasts, Spotify, or wherever you get your podcasts. Please don't forget to support our sponsors. We donate a portion of proceeds to charities supporting cancer patients in need. And we welcome questions and/or topic suggestions. So please submit at mybreastiesays.com.
The conversations on My Breastie Says are based on personal experiences and professional insight, but they are not intended to replace your medical advice. Always consult your doctor or licensed healthcare provider for medical guidance specific to your situation. We're here to support, not prescribe.
See you next time.
Bye!